So in this video, I want to show you how to complete the HCEC Rosetta File for the Healthcare Employer Council's Labor Planning and Forecasting Project. So for this, you're going to need two files. One, you're going to need the HCEC Rosetta. I'm working with version P1.3. You may be working with a newer version, in which case follow the instructions in that document and just use this video as a guide. The other document you'll need is the Healthcare Employer Council's Rosetta Stone Phase 1 All Descriptions and Surveys. And that document will help you figure out which occupations you should be reporting on. Okay. So first off, what you're going to want to do is kind of take a look at the 11 occupations. These are the 11 that we're reporting on. And so what you should do is develop a preliminary list of the occupations from your organization that you think may line up with one of these 11 occupations. So for example, if at the Alliance for Health we had an RN level 1, 2, and 3, those would probably line up with this code here. Maybe we have a residential counselor that fits with home health aide, and so we'd consider that one. Okay, so first develop a preliminary list, and then we'll start looking at the file. So open up the Healthcare Employer Council's Rosetta, and let's see, here we go. And first I want to show you that there is this piece right here called the Instructions tab, and this is a printable document, so feel free to print it off, and this explains just how to go through this. So you don't even need this tutorial, but some people like things to learn visually. So next, or the first thing you're going to want to do is save this. Okay, so we're going to click Save As, and we follow a specific file name format. It just kind of helps us track. So you do Healthcare Employer Council Rosetta Stone _ then the name of your organization, no spaces, capitalizing the first letter of each word. Oops. And then put in the date with periods in between and click Save. Alright, so next you're going to move to this Rosetta piece, and what you're going to do is then you're going to put in the name of your organization. So I'm reporting for the Alliance for Health, and then if your organization has a representative on the council, or then put their name down. If not, just put in the name of whoever is the primary contact between the Alliance for Health or the Healthcare Employers Council and your organization. So I'm going to put in Craig Nobelin, and since I'm the project leader for this, I'm going to put in my name, and I'm going to, like, if someone else was helping me, I'd put their name in, but right now we got James the Giant Peach helping me out. So, okay, you're going to skip the comment section and move forward. So, now that you've done this, what we want to do is we want to move to, or open up the Healthcare Employer Council Rosetta Stone Phase 1 All Descriptions and Surveys. So we're going to open up this document, and let's see if it's opening. Hopefully we can get it open. There we go. Okay. And what you'll see here is we have 11 different tabs, each corresponding with one of or each of the 11 occupations from the ONET. So here I've opened up the Registered Nurse tab, and this is a printable document. What we've done is we've listed out the core tasks and the supplemental tasks for the RN position as defined by the ONET. So what you'll do is you'll take this and you'll compare the job description of the job title from your organization with the description from the ONET, and you'll say, okay, does the person in this RN level 1 position at my organization, do they monitor and record and report symptoms and changes in patient condition? Yes. Okay, I'm going to check this. And I'm going to go down the list. And then I'm going to go do the same thing with the supplemental tasks. At the end, I'm going to ask the question, was this a good match or was this not so good a match? If it's not so good a match, then I'm not going to include that job code in my report and move on to the next one on my list of potential job codes. Okay, so you may be asking what's a good match and what's not. Well, it's kind of up to you to make that decision. It may be that a good match is 90% of the boxes are checked. It may mean that only 50% of the boxes are checked. It's your call. Try to be as accurate as possible, but it's up to you. So, and let's say you get to a job code where you're like, I really don't know much about this job code. We've designed this to be something you can print out and you can hand to someone else. So you can take this and put someone's name in here, or put your name in here, and then find a manager, or let's say you can find someone within that occupation and put their name here, and then just say, okay, I'm investigating this job title and it's classified as this job code. Okay, so put that in, hand it to the person, have them fill it out and give it back to you. And then you can, if they say it's a good match, then add it to the report. If not, disregard it. Okay? So after you've gone through all the lists of the potential lists that you had, you're going to then go back to the Rosetta. So let's open that up. Okay? So let's say that I'm going to start with RN level 1. We don't really have RNs at the Alliance for Health, but it's an example. So, and let's say we classified them as RN 101. That was the job code we gave them. Now we determined that they matched up with the registered nurse. So I'm going to click that. Next, I'm going to look at the education required. And let's say at the Alliance for Health, we require an associate's degree. And the education preferred, maybe we preferred nurses with the bachelor's degree. Okay, credentials required and credentials preferred. Let's say we require state licensure, and we don't really prefer any more credentials other than that, so we're going to leave that blank. You can leave education preferred blank if there's no higher level. So finally we have setting, and so here you see acute care, ambulatory care, rehabilitation, behavioral health, physician staff, durable medical equipment vendor. Durable medical equipment vendor is kind of like your pharmacy, your standard pharmacy such as CVS pharmacy or your professional pharmacy. Just those would be DMEs. So okay. And then let's see, we also have long-term care and home care and other in case you have another setting. So should note urgent care is rolled into ambulatory care. Okay. So let's say these nurses primarily function in rehabilitation, but we're going to say, and so that setting is there. Now maybe this occupation also includes some home visits, so we'll include home care. So primarily they're in rehabilitation, and so setting here, but sometimes they do home care, so we'll put that in setting too. Okay. Now they don't do any other settings, so we're going to leave that blank. So most of your occupations, you'll see only one setting. Some of them will have two. Probably be pretty rare to have 3 different settings. So, and that's it. That's all you need to report on for each individual job, and you'll just go through and fill out the rest of the job codes that aligned with those 11, the ONET. And then as soon as you've filled out the rest of this, go back to the comment section and fill in any comments. Let's say you weren't sure about something, you reported it and you weren't sure. Just type a note about some of the assumptions you made or decisions you came to. Just put that there. If you have any questions or if there's something that you think should be improved, feel free to write it there. As soon as you're done, save it and email it to hanspalma@afh.org. So thank you very much. That is all.